I think we all know the CDC has done a great job of getting this information out there. There are so many different resources, but I think sometimes there's a struggle to communicate that to the rest of our staff who come from different backgrounds. You know, you may have LPNs rooming your patients, you may have MAs, you may have CNAs rooming your patients. And so, how do you further digest and get that information out to your staff is also important because let's be honest, I work in a rural practice, so my front desk workers they get asked at the Walmart what vaccines that the patient needs to get and things like that. And so, one thing I found in my practice is I will put out just an even further simplified chart to explain the vaccine and who needs the vaccine and kind of why, so that our other staff members can at least be familiar with it. Not that they're making recommendations beyond their scope of practice, but that they can at least know where the questions are coming from, and that's been helpful for us. Dr. Rockwell, do you have resources that you share with your staff in particular?
I agree with everything you said. We're still working on our sort of diagram for the pneumococcal vaccine sort of algorithm, modeling the CDC recommendations, but making it clearer in a step by step way. And I think that is very important for staff. I also recommend folks consider downloading the SHOTS immunizations app onto their phone. It's SHOTS. It is a collaboration between the Society of Teachers of Family Medicine and the American Academy of Family Physicians, nonprofit. And it goes through vaccine recommendations, including pneumococcal, but it also allows you to input patient data, such as age, health conditions, other social conditions, smoking, things like that. And then what vaccines are recommended just sort of pop up for you and it makes it easier. But for your like physicians or PAs or other vaccine providers, your maybe pharmacists are giving vaccines. There is another nonprofit organization called Immunization Action Coalition or IAC. It is a collaboration with the CDC and the American Academy of Family Physicians, again, where they have a column or an online column called Ask the Experts. So if you run across a question about a vaccine, and it happens that you cannot find a resource on the CDC website or any other sort of established website, you can email in a question, ask the expert, and they will get you an answer. So that's a great resource as well.